Hey there, Toby Stark, Stark Associates Insurance Agency. We often get asked in our office about is Medicare only for people age 65 and older? And actually, it's not. That's a common question that we get. You can be eligible for Medicare before age 65 under certain circumstances. And I put an article together here up on the website. Just understanding the Medicare eligibility rules is critical so you don't miss coverage or enrolling correctly. And I've run into this before where people have been on Medicare before 65 and they didn't realize that they had options. And then not only that, they didn't realize as they approach 65, they could take a look at other plans with no underwriting, depending upon what state they live in. So, what is Medicare? Medicare is a federal health insurance program primarily designed for people age 65 or older. And those of you that are 65 and watching this do know that because most solicitors and marketers know that you're coming up to 65 and you need to make a decision. So they hammer you with solicitations. Certain individuals under 65 with disabilities and people with end stage renal disease or ALS do have eligibility into Medicare. So most Americans become eligible for Medicare when they turn 65, and this applies if you are a U.S. citizen or permanent legal resident and you have worked, or this is a big one, your spouse has worked at least 10 years or 40 working quarters paying Medicare taxes. Surprise, Medicare isn't free. You've prepaid most of this benefit. At age 65, you can enroll in Medicare Part A, which is your hospital insurance, Medicare Part B, which is your medical insurance, Medicare Part D, which is your prescription coverage, or you can choose a Medicare supplement policy, Medigap, and stay on original Medicare, which is Part A and B, or leave it and go to a Medicare Advantage plan, which is a managed care plan with networks, co-pays, prior authorizations, and maximum out-of-pockets. Can you get Medicare before age 65? You can. Medicare is not only for seniors, people with disabilities, if you're under 65 and have received Social Security Disability, SSDI, for 24 consecutive months, you'll automatically be enrolled in Medicare. And that includes Medicare Part A and Medicare Part B. Same thing if you have end stage renal disease, dialysis, or kidney transplant. Enrollment is not automatic and timing rules apply depending when this happens. Also, same thing for ALS. What Medicare coverage options are available under 65? If you qualify for Medicare before 65, your options will be more limited. Medicare Advantage plans are often available, and Medicare supplement plans are restricted, and they could be more expensive. Usually, there's only one Medicare supplement plan option. Now, the important part is that depending when you pick, when you lead up to your 65th birthday, let's say you're 60, and you've had 24 consecutive months of Social Security disability, and you automatically get enrolled. Now you have a guaranteed issue situation on where you can go into a Medigap policy or you can go into a Medicare Advantage plan depending upon what you choose. But leading up to your 65th birthday will be your initial election period all over again, even though you're already on Medicare. And this is a point of confusion for most individuals. They think that the plan that they took at 60 because they had Medicare means that's the plan that they have to stay on, and that is not true. Turning 65 creates another enrollment period for you with no medical underwriting where you can change plans. A lot of people that enroll in original Medicare and a Medicare supplement have one plan option when they're 60, let's say, and they haven't turned 65 yet. But when they're 65, they have many other plan options, and they should definitely look at those other plans because the plan that they were currently on, the only option that they had, could be significantly more expensive, not only at 65, but also throughout their lifetime, rather than making a plan change for a like plan. So we help clients all the time navigate those waters and inform them that no, they can make a decision and change plans. They usually do not know that. So, why this Medicare question matters? Many people assume Medicare starts strictly at age 65 and miss opportunities for coverage or worse, face penalties for coverage gaps. If you're under 65, approaching 65, helping a spouse or parent, or confused by Medicare, you need to get personalized Medicare guidance. And you can get help on your Medicare eligibility. The rules are, we know, not one size fits all. So the right plan does depend upon your age, health, prescription, budget, and your long-term needs. So know that no, you cannot not double negative. Just make sure you're paying attention. Get Medicare before 65. If God forbid, if you're disabled and you have those consecutive months, you can be enrolled. But know that there's another enrollment period approaching at 65. Toby Stark, Stark Associates Insurance Agency. Happy to share these articles with you. Take care.